Bringing you facts over fear here at WCNC Charlotte, and we've seen lots of claims regarding the virus and how to treat it. So joining us live is Dr. David Geier. Thanks for joining us, Dr. Geier.
Thanks for having me.
So as we just mentioned, a lot of confusion on what can possibly help treat the coronavirus. So first, let's talk about hydroxychloroquine, why it's still okay to use in a hospital or trial settings when we have these risks now that we know about.
In the hospital setting, it's much easier for physicians to closely monitor for any kind of biologic changes when you give not just hydroxychloroquine, but any medication. It is known, as you alluded to just earlier, that people with known cardiac arrhythmias, abnormal heart rhythms, can develop serious complications from taking that. And so when you have the full medical history, then the doctors can safely decide when it might be used and when it not, and adjust accordingly based on a patient's symptoms.
So as you know, the state of Georgia is starting to reopen. So as a physician, what are some of the concerns with possibly doing that too early and how it could affect us here in North Carolina?
I don't have much in the way of numbers as far as where they are in the curve. When you look at hospitalizations and cases and tests to really speak yes or no, should they or shouldn't they. My point of it would be, if you're in Georgia, you still take all the precautions. I know everybody wants to work, but yes, if you have any kind of medical history, maybe you still stay at home as much as you possibly can. Wearing masks in public, still keeping your 6 feet as well as you can. Wash your hands and don't touch anything that potentially could be contaminated, and then touch your face. Those kind of things are just as important now, even as you start to loosen some of the restrictions on what businesses can be open.
We've had some viewers write in wanting us to ask a medical professional what medical advice is suggested for addicts or alcoholics and possible relapses during isolation.
I don't know if there's specific guidelines that have changed because of this. What we recommend pretty much to every addict, and that still really applies. I would encourage you, especially if you're in a stay-at-home situation where you have supportive family members, and I know that's not always the case, sort of to help you self-monitor as much as possible. That's not a perfect answer for everybody, I know, but if you can get as much support as possible, or even if it's through social connections with Zoom and Skype where you talk to a support partner, that can be really helpful in this very stressful, very uncertain time.
All right, Dr. Geier, thank you so much. We always appreciate your time and your advice.
Thank you.
Still to come on WCNC Charlotte, there's